Let us discuss this with Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public and retired consultant paediatrician. Hi, Dr. O'Sullivan. Thank you very much indeed for joining me. Doctors are still threatening to strike. They say they're not ruling out coming to some kind of terms, but the terms have to be attractive first.
I think that the negotiations for this, which went silent for several weeks, should have been going on all the time, and they may have reached a better resolution. But there's a real link between the doctors' strike and what they're arguing for. In this country, we haven't been meeting the cancer weight target for many years. A lot of the NHS targets haven't been met since 2015. And we simply don't have enough oncologists, that's cancer specialists. We don't have enough radiologists and specialist interventional radiologists, and we don't have enough scanners. And when the last resident doctor strike took place, I interviewed a couple of the young doctors there. One of them actually wasn't that young. He'd given up his previously very well paid career in order to commit himself to medicine and the NHS. And they had several worries. In addition to their pay, and perhaps in their minds more important, they were worried about seeing their friends and colleagues hemorrhaging out of the country and out of the NHS. They were actually very worried for the integrity and the safety, continuity of the NHS. And they were worried about not having any job prospects. There were two doctors who had finished their foundation training, and they didn't have a training job that would turn them into, for example, an oncologist or an A&E specialist or a GP. And they were really very worried about that, more so than pay. But of course, pay is also part of that. Pay has been significantly reduced since 2008, what the BMA is saying, a slogan. It's true that their pay has been undermined significantly, and the whole country has had that stress, but more so than anybody else, the junior doctors, strangely enough. So what they're arguing for is proper pay remuneration for the responsible job that they do, respect from the government and respect from society for the work that they do. And they want to be part of that team, just as they gave everything in COVID. What really impressed me with these two young doctors was that they were really sad to see their friends and colleagues leaving the country. They wanted the NHS to be as successful now as it was in 2010.
Obviously, the sacred sacrament of being a doctor, the Hippocratic Oath, etc., is all about preserving life. And this is, we're told, a super flu epidemic. The hospitals are absolutely teeming with flu patients. This is not a time for resident doctors or anyone else to go on strike. Wait till the summer.
The timing isn't, strictly speaking, of their own choosing. The legislation is that they have to ballot for the right to go on strike, and they got that in the summer, and it lasts 6 months, and this is the end of the 6-month period. They haven't reached a satisfactory conclusion with West Streeting, but the context is that if you're looking at risk to patients, and if you're putting patients first, then the NHS has to have enough staff to look after them and keep them. We have to retain staff. We have to stop thousands of doctors leaving every year, 40% of doctors reconsidering their NHS job, 40,000 nurses leaving the NHS in 1 year. We have to stop the situation where there's unemployed doctors, or over 20,000 who either can't find a job or can't find a training job to become the oncologists and the radiologists of the future. And instead, we have the under-resourcing of hospital system with 16,600, I have to repeat that, 16,600 avoidable deaths from delayed treatment in the A&E and delayed admission to the wards. That's 46 people every day dying unnecessarily. 1 in 5 patients in emergency departments are experiencing corridor care instead of being looked after safely on a ward. We've got fewer beds, doctors, nurses, GPs, scanners than the comparable European countries, and our social care is a mess.